Welcome to iMove Digital Learning. I'm Carla. I'm one of your lecturers from Normal Psychology. For this session, our topic is the prevalence of disorders. We will talk about how common particular disorders are in specific populations, for example, males or females. Now, to understand better how this topic may come up in the board exams, let's start this discussion with a series of test questions. First, which of the following personality disorders is more common in males? A. Borderline PD, B. Dependent PD, C. Narcissistic PD, or D. Histrionic PD. Pause the video if you need more time to think of your answer. The correct answer is letter C. Narcissistic PD. That is more common in males. Next, which of the following disorders are more prevalent in females? A. Oppositional defiant disorder, B. Kleptomania, C. Conduct disorder, or D. Pyromania. Pause the video if you need more time to think of your answer. The correct answer is letter B. Kleptomania. That is more prevalent in females. Final question. The most frequent subtype of delusional disorder is A. Persecutory, B. Grandiose, C. Nihilistic, or D. Somatic. Hit the pause button if you need more time to think of your answer. The correct answer is letter A. Persecutory. That is the most frequent subtype of delusional disorder. We will learn this and more when we come to the discussion proper. We will discuss the prevalence of disorders based on DSM-5 chapters. Let's start with neurodevelopmental disorders. For this set of disorders, autism spectrum disorder, ADHD, childhood onset fluency disorder, and language disorder are more common in males, while reading disorder or specific learning disorder with the reading disorder specifier is roughly equal between males and females. There is a high comorbidity or two diseases occurring at the same time in one person with regard to tics and ADHD, as well as tics and OCD or Obsessive-Compulsive Disorder. Approximately 38% of those with autism spectrum disorder also have intellectual disability. So there is also some degree of comorbidity between those two disorders. As for schizophrenia spectrum disorders, brief psychotic disorder and schizoaffective disorder are more common in females, while delusional disorder and schizophrenia are roughly equal among males and females. For men, the likelihood of schizophrenia decreases with age, while for women, the likelihood of the onset of schizophrenia increases with age. So there is an opposite pattern when it comes to the onset of schizophrenia. So the older men get, the less likely they are to have schizophrenia, while the older women get, the more likely they are to have schizophrenia. The most frequent subtype of delusional disorder, as we have practiced in the test question before, is persecutory. Again, that's the most frequent subtype, delusional disorder. Let's move on to mood disorders. Disruptive mood dysregulation disorder is more common in males, while major depressive disorder and persistent depressive disorder are more common in females. Bipolar disorder occurs roughly equally among males and females, though women are more likely to be in a depressive rather than a manic phase. For cyclothymic disorder, women may be more likely to present for treatment, though this disorder occurs again roughly equally among males and females. As for anxiety disorders, generalized anxiety disorder, especially in developed countries, panic disorder, agoraphobia, specific phobia, and selective mutism are all more common in females. Social anxiety disorder is roughly equal among males and females. A large proportion of males with unexpected panic attacks are said to cope by consuming large amounts of alcohol. So anxiety disorders in men are likely to lead to substance use disorders as well. Specific phobia is the most common anxiety disorder, while the second most common is social anxiety disorder. For obsessive-compulsive disorders, trichotillomania and excoriation are more common in females, while obsessive-compulsive disorder, body dysmorphic disorder, and hoarding disorder have a roughly equal distribution among males and females. Boys, though, tend to develop OCD earlier, and men tend to have more severe body dysmorphic disorder. The most common obsession is the symmetry obsession. Things need to be perfectly symmetrical, perfectly aligned, and even. This obsession is followed by forbidden thoughts or actions. That's the second most common. Third most common is cleaning or contamination obsessions. And the fourth most common are hoarding obsessions. For trauma and stressor-related disorders, the highest rates are among survivors of rape, military combat and captivity, and genocide. For somatic symptom and related disorders, somatic symptom disorder and conversion disorder are more common in females, while illness anxiety disorder has a more equal distribution among males and females. For dissociative disorders, dissociative amnesia and dissociative identity disorder are both more common in females, while depersonalization, derealization disorder have a more equal distribution among males and females. The most prevalent dissociative disorder is dissociative amnesia. Again, dissociative amnesia. Next, eating and elimination disorders. Nocturnal enuresis or enuresis during the night, as well as encopresis, are both more common in males, while anorexia nervosa, bulimia nervosa, binge eating disorder, and diurnal enuresis or enuresis during the day are more common for females. Rumination disorder, in which food is repeatedly regurgitated back to the mouth, is commonly reported in individuals with intellectual disability. In other words, there is some degree of comorbidity between the two. As for sleep-wake disorders, sleepwalking in adulthood is more common in males, while sleepwalking in childhood is more common in females. Insomnia disorder and nightmare disorder are also more common in females. Hypersomnolence disorder has a roughly equal prevalence between males and females. For substance-related and addictive disorders, substance use disorder involving alcohol, cannabis, hallucinogen, inhalant, sedative, hypnotic, anxiolytic, opioid, and cocaine substances, as well as gambling disorder, are more common in males. Amphetamine use disorder and tobacco use disorder have a roughly equal prevalence among males and females. And individuals ages 18 to 24 years old have the higher prevalence rates for the use of virtually every substance. Again, ages 18 to 24. For disruptive impulse control and conduct disorders, the following are more common in males: oppositional defiant disorder, intermittent explosive disorder, conduct disorder, and pyromania. Kleptomania is more common in females. For neurocognitive disorders, there is a slightly higher risk for men with regard to vascular NCD. So NCD which involves some sort of a disease in the blood vessels. So it could be hemorrhagic stroke or ischemic stroke. And as for females, there is a higher risk for Alzheimer's type of NCD. For personality disorders, the following are more common in males: paranoid, schizoid, schizotypal, antisocial, narcissistic, and obsessive-compulsive personality disorders. On the other hand, histrionic, borderline, and dependent personality disorders are more common in females. Okay, I'll give you a bit time to study that. Next, avoidant personality disorder has a roughly equal prevalence among males and females, and people tend to be diagnosed with more than one personality disorder. So there are often comorbidities of personality disorders. Next, paraphilic disorders and gender dysphoria are more prevalent in males, and the least common male sexual complaint when it comes to sexual dysfunctions is delayed ejaculation. Again, that's the least common. That ends our discussion on the prevalence of particular disorders in DSM-5. I hope some of this information will help you when it comes to answering questions in your board exams. To end, I leave you with this quote: "You get what you work for, not what you wish for." So it's not enough to wish for, desire, and dream about something. It's important that we put in the effort and the work needed to realize those wishes and dreams. Thank you and good luck.